What you can expect to happen when you go in for a scheduled C-section. This is part 2. What happens during preparation for surgery in the operating room. This part takes, let's say, 15 minutes. So you walk into the OR without your support person, but with your caring, supportive medical team. Maybe they turn on some music for you, introduce you to anyone in the operating room that you haven't yet met. You sit up on the bed in the OR table. Your hospital gown is going to be open in the back, and if you're cold, you can have a blanket in the front. You get a couple anesthesia monitors, blood pressure cuff, a pulse oximeter, and then you get your spinal. Short story is, your back is cleaned off, a plastic drape is placed on your back for the sterile field. We touch your back, feel around for the best place to do the spinal in your lower back. A little area of skin is numbed, which is where we'll be placing the spinal needle. The spinal needle goes in, enters the spinal space, and then we inject medication through it. Once the medication is in, everything comes off of your back, and then you lie back down onto the OR table. Your arms will go out to your sides. Baby's heartbeat will be checked one more time. EKG stickers placed as an additional anesthesia monitor. Compression boots on the lower legs. A big sticky pad on your thigh. Legs are starting to feel tingly or warm, a little bit heavy. A Foley catheter is placed in the bladder. At this point, it's normal to feel some touching, but it shouldn't hurt. You may not even notice it. Sometimes some hair trimming is necessary. Safety belt goes over the legs to keep the asleep legs on the table. Anesthesia is checked. Lots of ways to do that. And then the whole belly is cleaned with an antiseptic skin prep. Gotta make sure nothing touches that while it dries for 3 minutes. Once it's dry, a giant surgical drape is placed covering everything below the boobs and kind of up and attached to 2 poles. There's just a hole in the belly area where the OBs do their thing. Antibiotics are given through the IV if not given already. And then we do a surgical timeout where everyone in the room says their name and what we're doing there today. OBs then also do a test for the anesthesia, and once we're all happy that everything is working well, partner can join and we can have a baby.